Hi everybody, this is a video about one of my favorite topics, ozone therapy. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos asking how often should intravenous ozone therapy be done? So it's a really good question. And it's going to vary depending on what the goals are. So if a person is generally healthy and wants to get some extra ozone therapy treatments in to help promote their lifespan, health span, then that's going to be one answer. If a patient's having terrible pain issues, that's going to be another answer. If a patient's dealing with some type of chronic infection like persistent borreliosis or Bartonella or something like that, that's going to be a different answer. So it really depends on what a person's dealing with. As a couple of general principles though, if a person is, presuming that they're working with a comprehensive protocol going after, say, the mold that they're dealing with or chronic infections that they're dealing with or whatnot, treatments are usually done 1 to 2 times per week. Most of our patients wind up doing the treatments once a week, just typically for logistical purposes. Oftentimes our patients live quite a ways away, and so coming in more than once a week can be challenging, especially if they're having major issues with, say, like post-exertional malaise or things like that. They might not be able to make a trip more than once a week, at least initially, until they're starting to feel better. But some patients do come in twice a week, and we do get more momentum when we're able to do treatments twice a week. And if it was something like just a general health maintenance, kind of health support or health optimization type of treatment, then doing a treatment, say, every 1 to 3 months would be something to consider. One thing that's of interest to note, and I think important to note about ozone, is that as best we can tell, ozone's working through this hormetic response. So we're basically applying ozone to the body, which is this incredibly oxidative stuff, oxidants being the opposite of antioxidants. So it's actually kind of this stressor on the body, and then the body has to cope with that by compensating by basically creating more anti-inflammatory molecules in the body, creating more antioxidants to buffer the effects of the pro-oxidants, and it winds up having a net effect. So it's kind of like, pushing back this way, the body pushes back even harder with all these positive things back in the right direction. Now, the one thing to note is that ozone's not just a hormetic stressor. It does actually result in direct oxidation of, or oxygenation/oxidation of the body's tissues. So the ozone reacts with different compounds in the blood, creating something called ozonides. Those get into the cells and actually deliver more oxygen to the tissue. So there are some studies showing that tissue levels of oxygen are higher after getting an IV ozone treatment, which makes a lot of sense. So there are some direct oxygenation benefits, which are good, but then there also are those hormetic stressor components too. So the reason I mention that is because when it comes to hormetic stressors, 2 things. One is that we want to be mindful of how much of that stressor can a person's body buffer depending on their current state of health. So I've had some patients where they're just in a very weak, depleted state of health when we first start working together, and in some cases, as best I can tell, I think their bodies are still going to be able to handle the effects of the ozone, and in many cases they do. Sometimes we'll start with a bit of a lower dose, but usually they can handle it quite well. But if there's certain patients where they just seem to be really, really, really down in it with energy and whatnot, sometimes we'll actually wait until we get some momentum built up with oral supplements and different things like that, or we might work with something like intravenous nutrient therapy before we bring the IV ozone into the mix, if it looks like their body might not be able to kind of bounce back, so to speak, from that initial little bit of stress that's caused by the ozone. So the kind of overall state of health of a person is something that's going to come into play in terms of how often we want to use ozone or when we want to bring it into the mix. The other thing to consider is that when it comes to it being a hormetic stressor, how often a treatment is done is going to dictate what kind of returns the person's going to get back from having that treatment done at a given point in time. So for example, someone like myself, doing very well health-wise, dealt with my chronic health issues years ago, generally feeling very good, thankful to say, happy to say. For me, if I was to do an ozone treatment, say, twice a week or even once a week, I'm not sure that I'd actually glean a whole lot of benefit over time. Maybe for the first like 1, 2, 3 weeks, like, yeah, there's be some health benefits, but my body would likely acclimatize and adapt to that, and I'd probably start getting diminishing returns with those ongoing treatments. Whereas, like, you say, get an IV ozone treatment once a month or every 2 months, every 3 months, well, my body's not going to be used to that ozone. It's not going to kind of adapt to that hormetic stressor in nearly the same way. So every time I get the treatment, it's kind of keeping my body on its toes a bit more. It's the same type of thing with, say, intermittent fasting, cold plunging, sauna therapy. Finding the right frequency with which we're doing these types of treatments is going to ultimately lead to the best types of returns, so that our bodies don't adapt too easily, and then we don't get those ongoing benefits, or don't get as much benefit rather for each treatment that we have done. So I hope that this answered the question. If there are any outstanding questions on this topic, or if anybody has any other questions related to complex chronic illness, don't hesitate to post in the comment section below, and I will do my best to answer as soon as I can.